So I'm sure people are often wondering what even happens when you come in for a pelvic physical therapy appointment. So I figured we would just have a chat about that a moment. So typically here, clients have already come in for their discovery visit when we've talked about what's going on with them and how we can help. So for the actual evaluation, we'll have made sure you've gone through your paperwork, we'll discuss your history and get a very clear picture of your concerns and goals and medical history. And then in terms of logistics with the pelvis, we do external and internal work. And so when we go in a room and we're looking at alignment and posture and different things, we're always trying to check and see what other underlying causes might be contributing to any pain or sort of torque that can happen with the pelvis. So when it's time for internal, I give you a sheet and I step out of the room and you take your bottoms off, and so you're laying there. Our rooms are very calm and dimly lit, more like a massage environment. And if there's something specific that we need to look at together, we can do that. But typically it's relaxed and you're under the sheet draped. But most common things for women, especially either in pregnancy or afterwards, we check the perineum, which is the tissue that runs across between the sit bones. It often can get stretched and inflamed when baby comes out. The head stretches that even if it's not part of a tear or an episiotomy. So we check the perineum, check kind of around the labial tissue, make sure nothing's inflamed. We can address hemorrhoids if necessary. And then you have 3 layers of pelvic floor muscles. So that first layer, we're only in about this far, kind of checking around like clockwise around the vaginal canal. Same for layer 2, we're in a little bit further, just checking the walls, seeing if there's tissue that's kind of lax or might be contributing to some discomfort, any tightness, restrictions. Then we can kind of check the other pelvic floor muscles that are deeper and more internal and might be affecting as they pull from the tailbone over to the sit bones. So we really help to balance out any restrictions that are torquing things on either side. And we do that addressing the external muscles here as well as abdominally and then internally when needed. And so once we kind of balance that out, we can also check your Kegel, can check you for diastasis or any splitting or extra strain on the abdominal muscles. A lot of women are wondering how to get back to exercise. We want you to be confident with that. So we check how you're firing your core, how your breath is, help you get all of that in sync if needed. We can obviously check for prolapse as well. And so especially depending, we work with a lot of athletes, whatever you're trying to get back to activity-wise, even if it's just safely picking up the baby or the car seat, we want to make sure that you feel confident in how your body's working and what's going on. So we release all those tight things that might be torquing on you and then help you to strengthen and relax whatever is needing to either be strengthened or eased up. A lot of women think that if they leak or something, that everything's just stretched out and flabby, and often that's not the case. Sometimes things are really tight and on. So we can just help you sort that all out.